Okay, so the next two measurements I want to discuss relate to peak torque and a temporal characteristic, so a peak torque with relation to time. And this is first and foremost the time to peak torque and torque at 1.85 seconds. And I've highlighted these in red just to get across that these are measurements that you can for the most part ignore. They have value, but these are measurements that have a greater validity and have been shown to have greater meaning doing an isometric test, not an isokinetic test. Their value and their use in isokinetics isn't as reliable, and I'll talk about why in a moment. Basically, both of these measurements relate to a concept known as rate of torque development. We've come across this when we've discussed linear kinetics and we've talked about rate of force development. So rate of torque development is simply the gradient of the line from the start of the test to when peak torque occurs. How quickly is that torque developed? The reason why this is less relevant, certainly with an isokinetic test, is due to a number of factors. One, a concept what we call pre-tensioning. So contracting the muscle before the test begins, before the repetition even starts. That conscious intent to engage the muscle is something that can and will skew the result. So the rate at which the torque is developed is obviously going to be much quicker if you've pre-contracted the muscle. If you're performing an isometric contraction prior to performing an isokinetic contraction, you're going to develop that torque much quicker. There are also studies that have shown that the cues and the prompts that you give to an athlete will make a difference, particularly if they've performed the test on more than one occasion, they're familiar with it. So for example, if your aim is just to develop peak torque, you may instruct your athlete to contract as hard and fast as possible, with the emphasis on the hard. You're trying to generate as much torque as you possibly could. However, it's been shown if you give the instruction contract as fast and hard as possible, or some variation of those terms, then the rate of torque development, so the time to peak torque and the torque at 0.18 seconds, will increase. So what you say to your athlete, or what you don't say, does matter and will affect your results, as will the pre-tensioning phenomenon. That is eliminated with an isokinetic test because there is no movement occurring. You are simply generating as much torque as you can in a static muscle action. So for the most part, you can infer information from this. Really, this relates to the neuromuscular capabilities of the muscle group under investigation. Excuse me. So how quickly basically that torque can be developed. Certainly here on the hamstring, on the flexion torque, the torque at 0.18 of a second, there is a significant deficit here in the flexion side of the test. But what you can really make of that and the validity of that in an isokinetic test is dubious. So personally, I would avoid these two tests, or certainly not make them, or these two readings, and certainly not make them the bulk of your discussion. Perhaps mention them towards the end, if at all.